Hello, Julian.
Hey, Mike. Hey, Mike, do you ever get a headache?
Yeah, I do sometimes.
Nasty, aren't they?
Yeah.
Yeah. Do you know there are some dogs and cats that get headaches every single day of their lives?
No.
Yeah, really. Let's get Clare Rusbridge on. Tell us about them.
Yeah. Hi, I'm Mike Brampton.
And my name is Julian Hoad.
Welcome to Veterinary Ramblings. Hello, Claire.
Hello.
Hi, Claire.
I think we're going to have a great evening tonight, and we're both really looking forward to talking with you. And
So ever since we had your date in the diary, I've been hopping around. So I'm so looking forward to it.
yeah,
And
all good. So what we're going to talk about then?
I wonder whether we should start off and ask the difficult question.
Oh, okay. Off you go.
No, I see what you mean. No, when I say we, you, I thought maybe ask it. It's difficult.
You promised me last episode that you would ask the question.
I didn't say next time.
3, 2, 1. I'm a little bit uncomfortable here. Clare Rusbridge, what is your favourite bread?
Vogel.
Oh, vocal bread. Now, we had a vocal bread in season 2 or 3.
And I've forgotten all about it.
Yeah.
When was it? Yeah, lovely, seeded, quite squishy,
Yes.
soft crust.
Toasts well.
Yeah,
But I've
toasts
not
very well.
had bread for a long time because Zoe doesn't like bread.
Quite right, too.
Zoe, the medical app.
Yes, the diet app. Zoe's not keen on bread of any type, it seems.
You have a pretty healthy lifestyle otherwise, though, don't you, Claire?
I try to. My hobby is yoga. And so I try to do, unless work gets in the way, and it does get in the way sometimes, I try to do at least 7 hours of yoga a week.
What?
Mhm.
How much?
7 hours.
7 hours. Wow.
That's like an hour a day.
And like an hour a day, yes. But sometimes some days no, and other days 2 hours.
And is this I'm sorry, I don't really know how you do it with yoga. Is it self-directed yoga, or do you have
No, it's classes.
It's
There's
class,
different
right?
types of yoga, and it's mostly Ashtanga or Vinyasa flow, which is a kind of, you move through different positions, shall we say.
Like a sort of Tai Chi, a yoga Tai Chi.
Yes, quite like Tai Chi. I used to have done Tai Chi. And I think the thing that I enjoy about it is that it's very challenging. And I think as a vet and somebody who obsesses about work and can get quite caught up on it, stressed, I need to do something that completely clears my mind. And it's not the meditation bit. I actually find that quite difficult. But I like the challenge of muscle isolation and trying to improve my strength, basically. So I'm very proud. I'm 54 years old, and I'm very proud that in my 55th year that I have finally managed to do a headstand.
Good for you.
Wow, that's fantastic. Well done.
Which is, yeah, I still can't do a handstand, but working on that. So sometimes people think yoga is not cardiovascular or that it's easy, but actually it can be very challenging, and you have to have quite a lot of strength to do some of the things, some of the poses. So I quite like doing some of the weird balancing poses.
And it all is based on core strength, doesn't it? Or
Yes, yeah.
centralized strength.
Yes. And I suppose I got into it because I was very injured after I had my first child, which she hates me saying, but she was nearly 5 kilograms in weight. And my pelvis separated, my sacroiliac joint separated when she was born, and I wasn't able to walk for 6 weeks, and everything was very unstable afterwards. So I took it up to try and improve my core strength, and have kept going ever since.
Brilliant. And you mentioned something about, I forget the exact term you used, but basically mental well-being comes into it, doesn't it? Because it is, being a vet generally is stressful, isn't it? And you're, if I could say, at the pinnacle for the veterinary world. The stress must build up. The buck stops with you in many cases.
Yes, I think all vets have stress stressful job. So I think it is a stressful job. And I think the bits that I find stressful are very similar to other vets. Some people are more stressful. Some caregivers of owners and owners of animals are more stressful to deal with. And that may be why they've been referred to me, because they are more challenging, shall we say. And the general practitioner feels that they would benefit from somebody with more specific knowledge. And
I
then,
guess what you're saying is that the people in first are saying, "Oh my Christ, it's Mrs. Smith again! Quick, let's refer her for heaven's sake." What is it? Is it musculoskeletal? Do you think so? Neurological. Let's get it to Claire.
yeah, something like that. But I have to say that that is a minority of my clients. But of course, the minority are the ones that can actually ruin your day. You can have done a fantastic job for all of these clients, and then the one that is the challenging one, you take it all to heart and that sort of thing. And then I suppose the other stressful thing is I have to juggle a great deal of things all at the same time. So I'm still a clinician and I see cases, and they don't stop calling or being sick or having problems. How can they? But I'm also a university professor, and I have a teaching commitment and a marking commitment and a research commitment and a grant writing commitment and a grant report writing commitment and PhD students. And I'm also involved in a couple of charities. And then you often get asked to do other things as well, like review papers. And so you feel that the workload is absolutely never ending.
Be interviewed on Veterinary Ramblings.
Yes.
Yeah.
Well, that's not work, guys. Chatting to you is not work.
Oh, good.
Thank you.
And yes, I definitely need a release. And I think the nicest thing that my daughter just mentioned ever said to me was that in a significant birthday, she sent a card to me and said, "Oh, Mum, you're such an inspiration with all you do, and you still have time for your Saturday morning yoga." And that meant a great deal for me, because it showed that no matter what, yes, I still make time for the Saturday yoga. That's still nobody's going to not going to have that willingly taken away, except when I'm on call on a Saturday. And I prioritize it over other things, manage to get everything else done, but still do that and enjoy that. And I think because I regard it as very precious, I really I really value that me time.
Brilliant. You say that you're still clinical
Mm.
and you are a professor and you've got your teaching duties and you are a leader in your field. I'm just wondering, we talked there about frustrations and whether there's anything you would like to change, particularly with regards to maybe some of the patients that you see or some of the clients, or if you've got any particular frustrations on customers or clients and their patients.
I suppose the frustration I have and the challenge I have is the disease I've been working for since I first saw my first case of it in 1995, which is Chiari malformation and syringomyelia. And I have that drives trying to find answers of that really drives my research, because I am so passionate about it. It makes me want to find out more, get some answers. But I do get frustrated that I'm also really an object of hate. An object is the right word on social media, that I have to put up with a lot of abuse and even professional slander, really, for that, because I advocate for the health of the dog and trying to improve the health. And basically what the message that I'm saying is that you should not breed from dogs that are unhealthy. But that is a very unpopular message, and nobody likes to be it's kill the messenger, basically.
Really?
And I've been told to drop off the face of a cliff, or at least stop banging on about syringomyelia.
By breeders?
Breeders, yes. Yeah. Certain breeders, very prominent breeders that when it shows are show judges and have the ear of the kennel club. And by the ear, I mean the people who say to the kennel club, "No, this is not a problem. She doesn't know what she's talking about," etc. Not that the Kennel Club are necessarily they wouldn't be rude in that way, not to my face anyway. And in some ways it's better because social media has changed a little bit in that they don't put so many public comments on. They tend to stay in their own chat room, so I just hear about it from what other people send me.
Wow.
Can I just stop you for a second, Claire, because this is really important stuff, and I think we're going to stay with this for quite a while. But I thought some of our listeners may not know what syringomyelia and Chiari malformation is.
Yeah.
And would you be able to
Yes, I mean,
I was going to
essentially
say
it is
not
that
dumb it down, but just explain it in non-medical terms.
yeah, essentially it is that the brain is too big for the skull, or to put it better, the skull is too small for the brain.
Right.
And you see it in certain toy breeds of dogs that generally have that, because they're toy, they're small in stature and they have usually quite attractive facial features. So they have a domed forehead, quite liquid, large. They're often described as large, although they're exactly the same size eyes as every other dog. It's just more of them. They're usually close together. The nose is quite central between the eyes. They look more like a baby, basically. And they are breeds like the Cavalier King Charles Spaniel, the King Charles Spaniel, the Griffon Bruxellois, Affenpinscher, Papillon, and Chihuahua are the main ones. Pug, French Bulldog also can get, but not quite as much. So their brain is
They're
basically
highly fashionable dogs, aren't they?
highly
Particularly,
fashionable dogs. So when you look at something like the Chihuahua, for example, which is a popular dog, you have two types of head of Chihuahuas, which people are not usually aware of. There is a so-called apple-headed Chihuahua, looks like an apple, and the deer-headed Chihuahua, looks like a deer. So the deer-headed Chihuahua has a slightly longer nose, a slightly longer head, so proportionally the head is longer versus the width, whereas an apple-headed dog is broad and flatter. And the deer-headed Chihuahua is the traditional Chihuahua. If you look at pictures of Chihuahuas 50 years ago, that's what Chihuahuas look like. And if you look at old paintings of Chihuahuas from Mexico, Chihuahua, they had that deer head. But of course, that people have bred them to be smaller. They so teacup Chihuahuas and to have progressively flatter and tinier muzzles. In the dogs that are affected by it, it's particularly noticeable in dogs that have a very sharp stop. The stop is the angle between the forehead of the dog and the nasal bone. And if you look at your regular bog standard domestic dog, so street dog in India, I always think they slope. They don't have a sharp angle, but once you get to a right angle, or even worse than that, that the stop actually is indented, that you can put your finger in between their eyes into an indent, that really risks the problem. But people like the apple-headed Chihuahuas. You can't actually find many deer-headed Chihuahuas. And when people who want to buy a Chihuahua go out to buy a Chihuahua, if you said, here's a deer-headed Chihuahua and here's an apple Chihuahua, which one would you like? The member of the general public, I can almost guarantee it, would say, oh, the apple-headed one, please. That's the cutest. And so we as humans tend to find these dogs much more attractive, but we do it as the cost, and people just don't realize that when you have a dome head of a dog, the humans will have a frontal sinus behind your forehead and then your brain behind that. The dogs are literally going skin, bone, brain. Their forehead is their brain. And their brain is too big for that tiny little skull. And when we miniaturize dogs, it's not a straight line. We don't find that Chihuahuas have got a much, much smaller brain than a Rottweiler, and so on. They're actually the Rottweiler's got a surprisingly small brain for the size of its head, although perfectly functional. It's just got a lot of muscle around there. And the Chihuahua's got a surprisingly big brain with very little covering over it. And there is a cost to the dog. Is quite unique as a species, that it can go from a Great Dane to Chihuahua. But when you bring in these extreme conformations, there is a cost to that, and the cost is the dog's health.
So the brain box being too small means that part of the brain always pushes out, doesn't it, through the
Yes,
hole at the back?
it doesn't fit. And if
Mm.
you think about the brain has to be quite squidgy and soft, because every time the heart beats, 20% of your blood volume goes to your brain. And if you think about the physics of that, you've got a very soft structure that's suddenly got to get all of that blood into it. So it has to have quite a lot of what we call compliance. It has to be quite squidgy. And
Mm.
when you put it into a tight space and then you add that blood, you basically ramp up the pressure that's in there. So these dogs have headaches. They have signs that would suggest head pain. So they,
Mm.
for example, yelp when you pick them up, because you suddenly pick them up, often under their armpits, the way a lot of people pick up dogs, small dogs, and they'll yelp as they're suddenly being lifted up. Or they'll yelp when they're jumping, or they'll yelp when they're suddenly moving at night. And that's because when you're laying down at night, your brain swells slightly with fluid, so it gets a little bit bigger. And when you're standing up, the fluid kind of drains away again. And
Mm.
so they scream in the middle of the night and wake up and have disturbed sleep. They may not want to exercise. I can remember very clearly that a vet that was doing the Crufts show was asked, what's a suitable dog for somebody who doesn't want to give their dog a lot of exercise? And the vet said, oh, a Cavalier King Charles Spaniel. And I thought, no, a Cavalier King Charles Spaniel should want to exercise. And normal
Yes.
Cavalier, one of the questions I ask is, can your dog exercise for 60 minutes without showing signs of fatigue? A dog should be able to do that. If they're not able to do that, then there's an issue actually there.
And that's the problem, isn't it? We've bred these dogs that can't exercise, therefore they don't exercise.
Yes. And we
It's sort of
normalize that by
self-fulfilling
saying,
prophecy.
oh, Cavalier's a bit lazy. Yeah, they're suitable for a granny or for people who don't want to do much walking. And actually, then they're not like that at all. They shouldn't be like that. And that failure to that tight fit that the brain has can actually result in fluid that should be round the brain being forced into the spinal cord. And that's what syringomyelia is. It's fluid that's forced into the spinal cord, and it damages the spinal cord. That is this organ that takes these messages to and fro the legs. And that gives some quite specific signs depending on what area of the spinal cord is damaged. It may cause weakness. It may cause twisting of the spine, so scoliosis. And in the dog, because there's a scratching center in the neck, it will also cause something called phantom scratching, which is, or fictive scratching, which is a kind of scratching action to the neck when it's rubbed by touch or by a collar.
Oh, is that what the back leg suddenly scratching at the
Neck, yes.
Yeah.
And
I think
that's,
every vet has seen some really extreme versions of that. And I wonder, again, some of our listeners may have seen that, but it really is. It's more than just a little scratch. You can touch these dogs anywhere around their shoulders or head, and they will fiercely try and scratch the
yes.
air or the owner's hand or whatever, trying to pacify this non-existent itch.
Yes,
I
it's
think you were the one who
mal-
gave it the term, weren't you? You named it.
it's a maladaptive scratch reflex. We called it phantom scratching, or I called it phantom scratching. The breeders called it air guitar. They were aware of it from the 1980s. But actually, the first person to describe it was Sherrington.
Oh, he of the partnership of Schiff Sherrington with
Schiff Sherrington.
thoracolumbar nerve damage.
Exactly. And what Sherrington did was some rather horrific experiments in about, this particular one was 1905. And so he transected the spinal cord of dogs at about the high thoracic region. And when you did that, you got Schiff Sherrington, which, to explain to your listeners, is a high thoracic limb tone when the spinal cord is sectioned in the thoracic level. And you wouldn't expect that the forelimbs would have this high tone, because the transection of the spinal cord is after where the nerves to the forelimbs have come off. But it's because there is some information coming from the spinal cord that makes the forelimbs relax a little bit and be coordinated with the hind limbs. So it's because of that. And that was Schiff Sherrington, and that's what he's famous for. But what people were less aware of is he kept those dogs alive. And 3 months after he transected their spinal cord, they developed that phantom scratching, which he called fictive scratching. And it's a different mechanism to the syringomyelia, but it is the same action. If you look at his description, it's exactly the same. And it's because of the interruption to that scratch mechanism. And actually, many laboratories across the world create fictive scratch models deliberately by transecting the spinal cord in turtles to create fictive scratching, because this type of maladaptive reflex that develops after severe spinal cord injury, you can also get a walking reflex called spinal walking. So if you transect the spinal cord and you put a very light animal like a cat or maybe a dachshund on a treadmill, you can sometimes get them walking again. It's not a walk that they have conscious control over. It's a reflex walk, hence the name spinal walking. But if you can create spinal walking in a paraplegic human, then they will walk after a fashion with support. And so there's a lot of research looking at fictive scratch, because if you can understand the mechanisms of it, you can understand fictive walking. And sure enough, there are now some people who have implants put into their walking center in their spinal cord to make a walking action, even though they're paraplegic.
Claire, you said something there. You said that breeders of these dogs call it air guitar.
Yes.
I'm presuming here, and not wishing to put words into your mouth, that this is described along the lines of air guitar, ha 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 ha.
I think they don't use it quite so often as they did. They first noticed dogs doing this in the 1980s, and there were quite a few dogs that did it.
Status quo era.
Pardon?
The status quo era.
Yes.
Yeah.
And it's called the air guitar because they're making a movement with their legs, but not actually making contact with anything. And when I first described syringomyelia, and as a resident at the Royal Veterinary College, I knew there was something wrong with cavaliers, because I was seeing a lot of cavaliers in a lot of pain. And we were doing the standard test that you did at the time, which was a myelogram, and not really finding the answer. And I thought there is something wrong. And then I saw my first case with this Bo, and he came in doing the air guitar, doing the phantom scratching. And I did as a good vet should always do, not presume what the problem was. So I asked what this dog Bo was come for, and the owner said he's weak on his front leg. And so she described the weakness, and she described, I said, any other problems? And she just didn't mention the phantom scratching, even though the dog was just scratching. And I was walking around scratching, and you're like, what's going on? Why is she not mentioning it? But in the end, I said, what about the scratching? And she said, oh, no, that's just a bad habit he has. And he's been investigated by dermatologists and told that it's just a bad habit. And I thought, that's not a bad habit. That's definitely something neurological. But I did all the tests, the myelogram, etc., and found nothing. In retrospect, I would now know that I could see the myelogram was actually outlining the cerebellum that was in the spinal canal. But at that time, even the radiologists weren't really aware of that. And then I had another case. It was a PDSA video, a question from a vet of the PDSA who sent a video in. And I was thinking, scratching cavalier, this is really weird. And then there was another one. I thought, right, this time I'm going to find the answer. And this time I did the myelogram, and I did it from a lumbar puncture, which is lower down. And I realized as soon as I did the lumbar puncture, there was something really weird going on, because the flow of cerebrospinal fluid was so fast. And I thought, I think I'm in a syrinx. I think, because I'd had heard of the word syringomyelia, and I didn't know what that was. So I put a tiny bit of contrast and showed that there was a syrinx, fluid-filled space inside the spinal cord, which meant I nearly fell on the floor with shock, horror. I've killed the dog, etc. But I hadn't. The dog was absolutely fine because I'd done it very gently, and persuaded a good friend of mine, Jerry Davis, who set up Davis Veterinary Specialists, to help me MRI the dog, because there was no spinal MRI for dogs, and that's how we found the first cases. So I thought there is something in Cavaliers. I'll write to the Cavalier Club and let them know. That's what the responsible person would do. How naive I was, because I just had no idea that it would be so regarded as such a bad thing. And I got a letter back. That letter was destroyed because I know because other secretaries of the club would never found it. But I did get one letter back, and I recognized the breeder's name because I've been starting to collect pedigrees by this time, and the name was rampant through the pedigrees that I'd collected. And the letter started, "Stop what you are doing, otherwise you will open up a whole can of worms. We know what you're talking about. We've been seeing it in Cavaliers since the 80s, but it's nothing to worry about."
Wow.
Whoa.
And I
Gosh,
thought that was a little bit of a red flag to a bull,
Yeah.
really, because I thought, no, you're not going to tell me to stop investigating this problem when dogs' welfare is at risk.
You've
So-
sworn an oath to uphold animal
Yes.
welfare
Yes.
and
Yes, to improve the health and welfare of animals under your care.
yeah.
Exactly. And I thought it was a very interesting letter because I thought we were taking the time to write to me by hand in those days, no emails.
No Google.
No Google. And you obviously know there's a problem. You obviously know there's something going on. And that breeder was being defensive. There were I have to say, there were many Cavalier breeders that were very helpful and open. And another person came forward and said that their dog had this and had been investigated at the Royal Veterinary College. And I pulled the record, and it was absolutely classic. But of course, it had been investigated at the Royal Veterinary College before. I think they even routinely doing myelograms there, and they just it was, the problem was the diagnostic tests weren't. So that's why I know the sort of first cases were definitely in the 80s, and the breeders said that that's when they first started to see it. The problem is really that here we are, 80s now, coming up for 50 years later, and we are no further on, really. So I
When you
suppose
say
one
no
of
further
my
on, you mean no further on with the breeding?
no, it's worse than it was. So in the early sort of 2000s, I and a number of other vets sort of set up low cost screening services for the dogs. So we were doing MRI scans at the Goddard's practice that I was at for £250 only.
What? I must have referred a dozen in those days.
And that didn't even cover the anesthetics. So we made a
Right.
loss on every single dog. But Goddard's were extremely supportive and allowed me to have a day a month where we just turned over the MRI scanner and tried to be fixing the problem. But many the charities that I'm now patron of, Cavalier Matter, raised huge amounts of money to help support the breeders. So a lot of those breeders got scans for free. And when I stopped doing it for free, that's when a lot of the breeders became particularly unpleasant to me. I was reporting scans from all over the world. So it looked like we were sort of getting somewhere. And we also took DNA from those dogs. And we did find some genes of susceptibility, but unfortunately, it's a multifactorial, complex inheritance, a bit like hip dysplasia is. And there's no simple gene test for these dogs. But they didn't like the still got a lot of abuse, of how I interpreted it, the fact that I perhaps be less lenient than other people. If you went to somebody who wasn't a neurologist and didn't have any qualifications in radiology, you could get a better result, that sort of thing. But I worked towards a BVA scheme, and they said they wanted that. The Kennel Club wanted that, so a health scheme. But as soon as the BVA scheme came, they all stopped their screening because they did not want to have a list, even though that list is really buried. Even if I try to find a list of screened dogs, I struggle. And so a member of the public would not be able to find it. But I guess they don't want to have any notification of dogs that may be affected. And
very, very naively, you'd think that breeders would want their dogs to be healthy, and anything that could make them healthier would be a good thing.
Breeders do want their dogs to be healthy, but what they want most is to have a certificate saying that their dogs are healthy.
rather than actually being healthy.
They don't want that. I would say that a lot of them, I think they're in a very difficult situation. So I'll give you one example. There was a champion dog that sired, I think, well over 100 litters and in his lifetime. And we knew that he was a problem because he was at the back of many affected dogs. His breeder had scanned him when he was 1 year old, and he was clear. And that was well publicized. But a syringomyelia is something that comes with age, and also not every clear dog will produce clear offspring. And so he persuaded this breeder to rescan her dog, free, of course, paid for it. This breeder was so worried about coming to the practice that she wouldn't come into the practice. We had to go out onto Wimbledon Common, because the practice was on Wimbledon Common. We had to go out onto Wimbledon Common like a womble and sign over the dog on a park bench and take it back to the practice, because she was so worried about her reputation if she was seen going in to have that particular dog scanned. That's how toxic it can be, how finger pointing it can be. Sure enough, the dog had syringomyelia. It was shown. And she very quietly went off and retired the dog. He was 10. So that was a very legitimate thing to do. And she never told a soul. And obviously, I was bound by confidentiality as a vet, not to share the details. And for years afterwards, I saw on forums, isn't it great that champion X of X is a clear dog? Thank goodness we have known clear dogs like him that are known to be syringomyelia free, and he wasn't syringomyelia free. And so the whole breeding community thought this dog was clear because he was, but he wasn't. And so she could never tell people that he was affected. I can understand that, because breeders who did that had such a hard time, a really hard time. And it's not just a hard time professionally, but it's their whole life, their passion. And so when they are, and it's certainly true that judges give prizes to their friends, I'm afraid. That's probably a controversial statement to say, but they do. And you have to know the right people and be in the right circles to win in certain show rings. And when you are being ostracized for what is your passion, what you really enjoy, it is horrible.
It's like being kicked out of a family, isn't it?
Yes, and I think so. Some of the breeders have lost their friends, lost their hobbies, lost a lot just by doing the decent thing and saying the right thing, and they get an ongoing abuse as well online, which some of it isn't. Lies go around the world much easier than truths. So it's a very complex situation. And the only way really to get around it is to make screening for these diseases completely compulsory, so that everybody has to do it. Everybody's in the same boat. As in countries in Scandinavia, and Holland, for example, Belgium, make it compulsory. There is no choice but to do it. And once you make it compulsory and everybody has to do it, then it becomes less of a thing and you can work towards it. But I think the problem now with some of these breeds like the Cavalier is that they are so inbred now, generation after generation after generation, that there just isn't enough genetic diversity. They just have too much similarity. So syringomyelia is only one of their problems, and all of them have Chiari malformation to a certain degree. They're not all affected by it, but they all have it to a certain degree. So if they all have it, how can you ever breed away from it?
And they all have mitral valve disease.
And they pretty much, I have to be careful with saying all have mitral valve disease, because that's when people jump down my throat and say,
well, I think we can say that. I think it's been fairly well documented.
It has been pretty well documented.
If they live long enough, they will all
get it. And so how do you ever breed away? And there was a campaign recently about the lucky Cavalier gene. You may have seen it. It was in Dogs Today. We've got the magazine here, I think. Here we are, the lucky Cavalier gene in Dogs Today.
Gosh.
And that is a protective gene in any complex disorder. One of the reasons why it's so difficult to find the genes is that the dog may have the gene, but it may have some other genes that protect you from getting it. And that's what this lucky gene is for the Cavaliers. but they estimate between 2 and 5% of the Cavalier population has it. So
Mm.
how can you possibly take such an inbred population and say, okay, let's breed from that 5%? And the
Yeah.
only sensible answer is to actually say we need new genes.
Yes.
And not to make it some sort of designer breed that bring back because Cavapoos can get this condition as well. If you go for a small little Cavapoo that looks really cute
Yeah.
with a domed head, tiny little legs, you really risk getting this condition. So
I was just about to say that, actually, because a
randomly,
lot of people,
yeah,
a lot of my clients come in with Cavapoos, say, I really wanted a Cavalier, but they have such awful problems that I thought, you get a hybrid, they go, we'll all learn about it, get a Cavapoo, and they won't have any of those problems. And then you sort of suck in a bit of air and say, well, yeah, let's just have a look, shall we? But you're absolutely right. A lot of people buy these posh mixes, posh hybrids, precisely because they think they won't have any of the problems of the pure, the line bred, the inbred.
and unfortunately, they're selecting the puppy to have the same problems because they still, what they really want is a cute little dog that you
With
can
the apple
cuddle
head.
and pick up and looks adorable. And I understand all of those emotions, but if you really want to get away from the problem, you need to have a dog that is bigger than cross a Cavalier to a dog that is bigger than it, because it needs more space in its skull, not less space in its skull. We have clever geneticists now. The Kennel Club has clever geneticists. We have the means to screen these dogs for all of these different diseases. You could do a careful breeding program.
Yeah.
And the thing is why are we so protective about these dogs being purebred? Where did that all start? When people desired to breed pure dogs, it was with this mistaken belief that you were actually helping to reduce disease. So that if you had a healthy dog and you bred it to another healthy dog, you would keep those healthy genes in. But that was around 1945 when we had less understanding of genetics.
Do you know, that ties in very well with another worldwide program of eugenics, doesn't it? And that didn't work either.
Exactly. And but it was that around about that area that people were talking about purity of blood. And that's what people haven't been able to let go. And in fact, to start off with, people who bred, for example, a Dalmatian, it was just a spotty dog. It was a spotty dog that went in front of a coach coming from the Serbia, Dalmatia region. And it didn't have a particular breed shape or standard. It was just a spotty dog. But then they developed the breed standards. And then after that, they closed the stud books. And actually, for many breeds, the stud books closed relatively late in the 1970s. So it's not been that we've had this completely closed stud books for hundreds of years. It's actually quite relatively recent thing. And look what's happened since the 1970s. Look how many dogs that we see. What other profession? The doctors don't say, oh yes, you must have mitral valve disease because you're a Cavalier. Or your back is painful and you're a French Bulldog. It must be intervertebral disc disease. We shouldn't diagnose just based on the breed that walks through the door. Not every Labrador Retriever has elbow dysplasia or is lame because of elbow dysplasia. But that is a huge proportion of how we make our decision is based on breed.
And our mental algorithm is geared to that, isn't it?
It is. And the situation is getting worse because we're not making clones of dogs. No, I'm not proposing that we make clones of dogs. We're basically combining genes together and doubling up. And the proportion of dogs that are bred from is a tiny proportion of the dogs that are available to breed from. So it just constantly genetic bottlenecking. And we do want dogs in this country. We don't want to import all of those dogs illegally from Eastern Europe. So there is a market for creating healthy dogs in this country, but we just need people to do it.
So this is the King Charles that you're talking about?
The Cavalier King Charles and the King Charles.
And
Two
King
different
Charles,
breeds.
I think a number of people would already say that the royal family is too interbred and that there are problems associated with that. Is that not treasonous, Claire? And will Harry be affected?
Ah,
I'm
that's a
not going
different
to. I'm not going to
subject.
delve into that. I would like to think so. Crossbreeding to the Cavalier King Charles Spaniel is being done in the Scandinavian countries. Norway, they have to, unfortunately, because of a court case, and in Sweden and in Finland. Isn't it sad that Scandinavia is going to save our King Charles Spaniel?
I was just thinking that. I was just thinking
Don't
that.
you
Yeah,
think that
absolutely.
it's actually the responsibility for Britons to save our King Charles Spaniel and our English Bulldog?
I
And
really
is
think so. Yeah,
Mm.
we chatted to Jane Ladlow
Mm.
a little while back, and there is some movement among breeders to improve the lot of dogs affected with BOAS. Why do you think they're more willing to help and to contribute to an improvement in BOAS than a neurological syndrome? Is it because BOAS is more obviously affecting them? They can't get away with it.
I'm not so convinced that they are really addressing BOAS because I'm a little bit cynical about
Mhm.
that. I think the problem with the BOAS testing and BOAS is that it gets worse as they get older. And as I said before, the breeders love to have a healthy dog, but they also like to have a certificate that says they're healthy.
Mm. Mm.
And the nice thing about the BOAS testing, which makes it very attractive for the breeders, is that there's a good chance that when you do the dog when it's young, that you'll have a better score. And I'm sorry, Jane, for being cynical, but also it's a very cheap test to do. It's
Yeah.
subsidized by the Kennel Club, and all you need is a stethoscope, which makes it very user friendly and easy for breeders to participate in.
Mm.
Whereas because it's low cost, it's quick, and there is a clear guidance. I have to say the traffic light system that they use is what we used to use in syringomyelia as well. So it says, no, this dog you don't breed and this dog you can breed. I think one of the problems with that traffic light system is that we then, after doing it for a while, we then analysed it and found that the rate wasn't decreasing particularly fast. And I found as a vet that it was very difficult to say, okay, in the traffic light system, you can breed a mildly affected dog to a mildly affected dog.
Mhm.
And then you see the results of that and you see affected puppies with syringomyelia, then that as a vet means that I am telling people that it's okay to breed those dogs and produce dogs in pain, which I really struggled with. And so when our breeding guidelines were revised, they were a lot stricter, and that made things much more difficult. It is certainly difficult for the breeders to pay for an MRI scan now because we're no longer offering two MRI scans for £250 because there was no longer the demand, and because a lot of the veterinary practices are no longer independent and have a lot of pressure on their very valuable MRIs. We struggle at my practice to get all of the dogs that are referred to us through the MRI scanner, let alone 10 Cavaliers, and just making a loss. You can't explain that to people, corporates, shall we say, that, oh yes, we're just going to make a loss today, complete loss. Everybody's not going to make any money because we're going to run through these Cavaliers. So one of the things I have been working on, this is my research, is to provide low-cost solutions.
Mm.
And that is why we have what's called the Headspace project. So what we are doing is trying to use machine learning to, first of all, make a better interpretation from the MRI, because at the moment the interpretation is made from one slice in the MRI, which is actually a bit, when you think about it, is one slice directly through the skull is actually not, the brain is a three-dimensional object. We're doing that, correlating it to CT. So the charity that I'm a patron for, Cavalier Matters, paid for a lot of dogs to have a very quick CT after their MRI. All ethics approved, of course, but as you probably know, CT takes about seconds. So we just literally took the dogs from the MRI, put them on the CT scanner because it was right next door, click the button, had the CT, and we're able to. So we can get some answers from CT. That's great. But even better than that, now we're correlating it to mobile phone footage of the dog's head, which is funded by the Dogs Trust. So we started off with video cameras. I say video cameras, I mean gaming cameras used for gaming, Kinects, they're called, that you can have to make yourself a little 3D self. I don't game, so on a video game. We used 5 of those around the dogs to create.
Mike and I are both nodding sagely, although neither of us game either.
No, I've given it up. I've given it up because I was used as the body double for Pac-Man. Big mouth, round body.
I thought it was one of the ghosts, but you're right. It does. Yeah, munch.
Yeah.
So we started with static cameras, and now we're moving to mobile phones. And so my real dream is that somebody will be able to take, a vet will be able to take a mobile phone footage of the dog, upload it, and it will be able to say whether the dog's at risk. And obviously not just a vet, but a show judge if they wanted to check that, or a breeder or a pet owner to be able to say, actually, your dog is at risk. So that is the solution I'm trying to come up with. But what I found is that it's a bit like the BVA scheme. You can provide these things, and that's meant to link to an statistical program called an estimated breeding value. But unless they engage in it, it's not going to happen. And so I also think it's important to educate the general public who are buying these dogs in what is a healthy dog. And that is the biggest question and challenge. Many people blame the breeders for selecting these dogs, but it's actually the public that are buying these dogs. And how do we change Joe Public, who doesn't do much research on their dogs? Let's face it, we would all like our clients, our caregivers, to come into the vet and say, what dog should I get? And have
Absolutely.
But we're like the last people that they would speak to. They're more likely to. And if you Google buy Cavalier King Charles Spaniel, the charities that I'm patron of don't come up even close to the top, because we can't compete with people who are advertising on pre-loved and that sort of stuff. And so how do you persuade the general public what is a healthy dog? What's a healthy dog shape? What's a dog that is not likely to have a myriad of problems that's going to keep them suffering all of their life?
And the real answer should be, you get a dog that isn't in pain all the time. And you mentioned pain earlier, and before that you mentioned that these dogs have headaches, and you see them, they have photophobia, they're afraid of the light, they blink a lot, they clearly aren't comfortable. And if there was some way that we could get the owners or the potential owners to realize that these are dogs that, without a lot of medication for their lives, will be in constant pain. You mentioned headaches a couple of times, actually. You mentioned right at the beginning, and then just before you spoke about the general guide to Chiari malformation and syringomyelia. I wonder whether you could talk a little bit more about headaches, but just in a very short space of time, maybe a minute or so.
Yeah.
16, Julian.
Yeah, 60 seconds would be ideal.
60
If we were to give you 60 seconds.
60 seconds of CPD, you mean, really?
Well,
Yes.
there's an idea.
You have done your research, Claire.
Okay, set the timer going then.
Okay, so you're up for the 60-second CPD challenge then.
Okay.
What are you going to do your 60-second CPD on then, Claire?
Dogs and cats can get headaches.
Right, so Clare Rusbridge, 60-second CPD on dogs and cats get headaches, starting now.
So the most common cause of headache in the dog is Chiari pain, which you see in toy breed dogs. It's characterized by signs of pain, including yelping during sudden posture changes, lifting, jumping, or rising suddenly. This is most commonly manifested by rubbing or scratching the back of the neck. They also have what we call as a pain face, a sort of grimacing expression. And as been said before, photophobia. They can also have behavioral changes. So Cavalier King Charles Spaniels, known as very sweet dogs, can become aggressive and they can have disrupted sleeping. Other causes of headache include damage to the trigeminal nerve, which can be traumatic or because of dental disease, or genetic in the case of Burmese cats, or damage to the first cervical nerve, so disc disease, neck trauma, and because these cervical nerves go to the back of the head, or possibly facial nerve damage to give you ear pain.
And it's there. Fantastic. Perfect timing. Brilliant.
There we go.
What a great
So
city.
would you
setting
prescribe an
seems to be.
aspirin then?
So no, but it's interesting. Paracetamol works much better than non-steroidal anti-inflammatory drugs in my experience for some of these pain syndromes. That probably doesn't surprise a lot of us, because although non-steroidal anti-inflammatory drugs have a central action, there are prostaglandin receptors in the spinal cord and in the brain. Paracetamol works much more centrally. You don't really understand all the mechanisms by which paracetamol works, but it actually avoids cannabinoid receptors as well. So I find the new VMD regulations a little bit, should we say, challenging, because
These are the ones that disallow you from prescribing paracetamol.
yes,
Yeah.
or ones that want you to prescribe a certain type of paracetamol that has codeine in it, which might cause constipation and straining, which might make my dogs worse, or do nothing at all. And I used to, yes, I find that quite, especially since we don't have proof that paracetamol, this is all anecdotal. So
it's actually now illegal for me to say to a client, oh, if your dog's not well over the weekend, you can give them some paracetamol.
No, well, I think what you have to do, Julian, in that case, is you have to say, I'm ever so sorry, because it would be illegal for me to tell you X, Y, Z.
Yeah,
absolutely. If I'm answering an emergency call, I can say to them, if you have some paracetamol in the house, you can give your dog a quarter of this, or half, or 1 or 2, depending on the weight. If they say I haven't got any in the house, then it's illegal for me to say, but you can get it from the shop next door.
yeah. And it's a problem, because one of the problems with Chiari pain is that their pain is not 24/7. They will have exacerbations.
Yeah.
And so my letters to vets would always include what to do in a crisis. And it would start with the simple, use paracetamol to top up their pain. And this would also limit costs to my clients in that, because I was very well aware that this is epilepsy, not a pain. But there was a study that said the biggest cause of death in epilepsy in dogs is expense of going to the out-of-hours vet. If you have to go to an out-of-hour vet repeatedly because of the seizures, then the cost of that mounts up so much that the owner will euthanize the dog because they can't afford it anymore. And so I've always been very aware of that. And I think anything I can do to make it less likely that the dog has to attend the emergency clinic on a bank holiday, the better. But I suppose the answer is that we always have to prescribe paracetamol from our clinics, even if it is the same solution as we would buy it in a chemist.
Absolutely.
But
the problem there is
far more. And I also find it a problem that we're being accused of being money grabbing.
I was going to say,
and
the
then
problem is
we're
completely at odds with the CMA.
Yes, and then we end up charging them a much increased price for paracetamol because we have to, and we want to avoid a criminal prosecution.
16p at Tesco's. Oh, sorry. Sainsbury's, Asda, Morrison's, other supermarkets.
Absolutely. We say to clients, oh, look, I'm terribly sorry. I can't let you go to the supermarket for it. That would be illegal. Here's some for £5.
Yes.
But I'm not trying to profiteer. How on earth are they going to believe us at the time that we're being investigated by the CMA for overcharging for lack of transparency? They're not, are they?
No.
So what do? We every puppy we see, we say, look, your puppy's fine now. And I feel there may be a bit of pain coming onto his little life in the next 10 to 14 years. So here's some paracetamol, and this is the dose to give him. We can't
It
do
has
that,
a
can we?
sell-by date, so you can't do that,
I
can
know.
you?
I know.
I think actually we need some more clarity over that. It would be nice if our big veterinary organisations, I'm sure they are seeking more clarity over that, but maybe the clarity is already in some countries. That's the way it is, and it's certainly true that there are things that we can buy over the counter at a pharmacy, for example, chloramphenicol eye drops that I have bought, she says very quietly, for my children, when I said it was for my husband, because infectious conjunctivitis is so common in
Yeah.
infants.
Yeah.
And getting time off to go to the doctor is challenging. And
Yeah.
I suppose it's the similar thing, really, as what I try to explain to clients, is that when you go and buy paracetamol from a pharmacist, they are assuming it's not for a dog. And if you said that it was for a dog, they would say, no, you cannot buy that for that dog.
I can empathise incredibly well with that, because I spent 6.5 hours in A&E yesterday. I got a thorn in my cornea.
Oh
And
dear.
after 6.5 hours, they took it out, and then they gave me a prescription for chloramphenicol eye drops. I knew I had them in the practice, but it would have been illegal for me to use those. So I had another 2 hours trying to get there. I couldn't drive because of my eye.
Correct.
So trying to get the taxi to take me to an all-night pharmacy so I could get some chloramphenicol eye drops.
Yeah.
Mm.
So so in answer to your question, paracetamol is probably better than non-steroidals, but non-steroidals can work for headache. Otherwise, headache can be quite challenging. We have to go to drugs which are affecting neuropathic pain, and sometimes weird drugs, like I will sometimes use something called topiramate, which is an anti-epilepsy drug, but it's a first-line drug for migraine in humans, and sometimes that will work, which is interesting, which actually suggests that maybe dogs have migraines.
And omeprazole.
Omeprazole, the jury's out for that, really.
I had a case that you know about. It was a shared case that did amazingly well on omeprazole. It had been on paracetamol, it had been on gabapentin.
Yes.
Didn't do very well at all. We added omeprazole, and overnight the dog's life was transformed.
And I think there are some. So the principle is that omeprazole affects secretion of
CSF
cerebrospinal fluid, and theoretically it can work. And certainly anecdotally, I've had quite a few dogs that have responded to omeprazole. I think the problem is that when they've done tests on it, the published papers have not shown a benefit. But it's very difficult to show effect on cerebrospinal fluid flow, actually. The people who wrote those papers would argue that they did very precise techniques, and they did. But when you try to, for example, in humans, there's something called normotensive hydrocephalus. Well, normotensive hydrocephalus because they're meant to be at normal pressure. But it's actually been recently shown that they're not at normal pressure. They're elderly people, and actually the pressure that they're at is probably high pressure. It's just that the normal range has been set by adult human males.
Right, yeah.
Because the people who volunteer for projects on CSF tend to be male students. And or maybe they just choose male students because they just want to have one sex. So they're looking at one sex and one age group, and that is not the same. So when you're measuring CSF production in beagles with a normal brain, with normal brain compliance, that is not the same at looking at CSF pressure in a cavalier with abnormal brain compliance and abnormal cerebrospinal fluid absorption, because cerebrospinal fluid is absorbed, not how most people think. It is absorbed through the nose and through the lymphatics on the skull base. So the reason why a lot of these dogs have a problem is they're not absorbing their CSF properly because they have no muzzle. They have less nose. And so I think it's very difficult to take an experiment that's done in beagles and say that this is applicable to Cavalier King Charles Spaniels. And the only other sort of paper that looked at omeprazole was looking at whether or not it reduced hydrocephalus. And I think the overall impression I've had with it is that it certainly works in the first 2 weeks. Whether or not it's sustained or not is another question. And I guess the answer is if omeprazole works for that particular dog, then sure, go for it.
Yeah.
And interestingly, anecdotally, there are a few humans who've been trying omeprazole since the stuff has been published on the dogs. A lot of people with syringomyelia can't get enough answers, and some of them are finding this stuff. And one person wrote to me, and she said how much better her life was since taking omeprazole. And then she proceeded to say, and by the way, I am claiming the discovery of this drug. I was like, really?
I think that's already been done.
Yes, I think that's already been done. And also, I'm not going to promote giving it to humans because I think that would definitely upset the Royal College.
I think it might. Yeah, I know it might.
Yeah.
Well, do you know, there are just so many directions I could go now. But Mike occasionally sends me little messages, bringing me back on track. And one of the things he sent me just now was that we've had an absolutely fantastic CPD from you, 60 seconds worth, but we can't actually log it on our RCVS1 CPD because there's been no reflection.
Oh, no reflection.
Yeah. So how would you reflect on that CPD? And then I have a follow-up question.
And certificate.
Oh,
I
what's
have to
the-
reflect on the headache. I suppose my reflection would be, how do we avoid headache in dogs? And as I've said before, we blame the breeders and the judges for selecting these dogs, but it's the publics that buys the dogs. So my reflective question is, how do you change the public's perception of what is an acceptable head shape when it's our human nature to find that head shape cute? And if I was to show you if general public, as I said, a picture of an apple Chihuahua or deer Chihuahua, they would say the apple Chihuahua was cuter. If I was to show them the Cavalier that was most likely to be affected, they would choose that. But we also see it with other breeds. I used to really want a Border Terrier, really love Border Terriers. Never actually had the time to have a Border Terrier, but one thing I noticed is that their heads are getting rounder. They have
this angle, don't they? Yeah.
Rounder. And even I used to, when I was a young vet, I roomed with a Rottweiler breeder. She's also a vet, and this was in the States, in Philadelphia. And so I lived with 3 Rottweilers, and they had long heads. But now Rottweilers are getting these kind of pug-faced Rottweiler, and the Rottweiler breeders are actually rebelling against that, and they actually are sending dogs out the ring for not having that. But it seems like we're selecting for that broadness of head again. And then in golden retrievers, I've seen golden retrievers that have frontal sinuses that are like dolphins. Literally, they're just coming out here. And so instead of having a small brain, which is bone, skin, brain, we're creating these enormous frontal sinuses to make these great big domed heads. So it's not, I think we have a fundamental problem as humans, that we find this attractive and we can't get away from it because it's in our it is our maternal and our paternal buttons. We find that attractive. So how can we break away from our human nature and allow dogs and cats and horses and rabbits to have rabbit, dog, cat, horse shaped heads?
I know. The French solved this. The French solved this in 1780. Was it 89? They solved the problem that we potentially have with King Charles and all of the inbreed.
Madame la Guillotine, is it?
Yes.
So your answer is to
1789, yeah.
chop off all of these animals' heads, is it? I'm not sure that's really. It might solve the headache.
That would solve the headache. Do you know, there's a friend of mine who has done a lot of work in animation and characterization. And there's this, I don't know if it's actually called Disney principle, but the Disney principle of creating a cute character is to give it relatively wide eyes, a domed head. Rather than having the eyes on the side, they move them to the front.
Yeah.
All these animals are looking wide. I knew. So I just did that expression to people who are listening rather than watching. I did that expression. And I know full well that I did not look at all cute. But it's that sort of wide-eyed and
Yes, it's a
domed
huge
face.
eyes.
It's a baby face.
It's the nose in between the eyes,
Yeah.
smaller nose in between the eyes,
Yeah.
facial features clustered together with a big.
Yeah. And I think it is all
round.
cultures that recognize that as a baby-like face, an infantile-like face. And that's what people find attractive. And I think they're not going to ever not find that attractive, subconsciously, subliminally. They're not ever not going to find that. What we need to do is break the link between that being attractive and something else being a healthy dog or cat.
Yes.
And there needs to be we are not breeding a small baby for you.
Yeah.
We're
And
not selling
I
you
think-
something that's going to be wrapped in swaddling and nursed. We're creating a living creature that needs to have a life without pain. There's a
We have
difference
to
there.
define what that looks like. Say this is, nostrils that are closed completely. Can't breathe. Nostrils have to be open. It's a very basic thing, but many French bulldog breeders struggle with even that concept that they say they do not want to have nostrils like a greyhound. But I know I would prefer to have my nostrils open to facilitate breathing. I think we have to define very clearly what that is, which actually does need some research. What is the minimum, I suppose, you can get away with if people are still going to want to have these dogs? And they will want to have these dogs because that, again, is, I think, one of the problems that many of my caregivers' clients have is that if they don't have a Cavalier, what do they have? They don't want a Cocker Spaniel or
No.
a Springer Spaniel.
Or a
They want to
Border
have something small that they can pick up and be a family dog. So what breed do you pick in that instance? If you don't like terriers, a lot of people don't like terriers.
Finnish Spitz.
But they may not like a really furry creature that's going to get massive around the back end.
There are some that exist, but I have been advising a friend on choosing a dog, and it's really challenging. And that friend is trying to do everything she can to be responsible, but she phones up the breeders and says, "Are you checking for their hip disease and elbow disease?" And none of them are, even though they are accredited breeders. It's insured breeders because they don't have to do those things. So I think even when you have clients that are really trying to find a healthy dog, it is really challenging for them to do so.
Absolutely, I couldn't agree more. Because we have, all of us, our fixed ideas on what our perfect dog is. Even if we can't vocalize it, even if we don't know the breed, we know what it isn't. So
Yes.
That's why none of us own a Borzoi, for example.
Borzois are lovely. The only problem with Borzois is from a neurologist point of view is if there is a field and there is a tree in it, then the Borzoi will hit that tree or any other stationary object and fracture their neck or their leg.
Yeah. I've only ever seen one Borzoi after a fractured neck because it ran into a lamppost.
Yes. And or twisted suddenly by a bush.
I think you may have treated that one actually.
Yes.
I seem to remember. Claire, we have a certificate for you.
Oh, do you? Can I reflect on that and put it into my one CPD?
I'll send it. So here we go.
This is the problem with not listening to podcasts, isn't it, Claire?
You don't know what to expect, but you have a certificate. It says certificate of being probably.
Oh, only probably.
Well, the
that's
best veterinary.
That is very, very kind of you, and that looks fantastic. I love the myelogram.
So there we go. That's my own myelogram.
This one you've done yourself. You've
one I did myself
earlier.
And I still do the odd myelogram because there are still clients who can't afford MRI, and I like myograms.
Yeah, back in the day, we did up to 5 a day at the Royal Veterinary College when I was a resident, sort of bang, bang, bang. You were really got
And
lit.
that was before digital radiography, so it would take 5 minutes a shot, wouldn't it?
Yes, and and then you had to go back because it hadn't positioned itself. It
Yes.
was just it's life is certainly easier since not doing myelograms, but when you had a good myelogram, it certainly provided the answer quickly and effectively.
It does that. And here, so on the left here, we have a wolf,
Yeah, I like the wolf. Yeah,
and then we have a Labrador,
yes, like the
and then
nose.
we have
Oh
God
my
knows what.
goodness. And then we have a mutant.
We have a mutant with no nose, a tongue that's 4 times the size of its body, and this
And
dog,
no
you
nostril, and it
bet
can't see.
you can't see it at all. They had awful facial fold
What's that
intertrachea.
dog called?
You're lucky.
It does look like a pug to me.
It's a pug.
Yeah.
It's a pug, a very overweight pug. It actually has pretty much every disease going to it. It's a glue ear. It had a phantom itch, air guitar.
A pug myelopathy as well.
Yeah, and the owner brought it in because it had a nipple growing where it wasn't supposed to.
Of course.
Had a nipple growing in the small of its back, and the owner was worried because she'd seen this nipple growing. It was a tick.
Oh wow.
And I said she ought to be happy that at least the dog managed to get out into long grass because I didn't think he could walk out of the living room. So there we go. And we see the nose progression from wolf.
Yes, we can. Yes, I can see
Yeah.
you've obviously taken some time doing this.
I took a while. And then at the bottom we have a yoga cat. So there's a cat sitting on a set of nice pressed laundried towels
Cows. Yeah.
doing some yoga.
Yes.
And at the top, which
It's
hasn't
not
come out
exactly
particularly well.
downward dog though, is it?
It's not downward dog, no. I think it's sideward cat. And the top one hasn't come out very well on the certificate. But it says, "This is the sign I saw when I was walking a couple of years back, doing a hike with some friends, and it says, 'Sat nav wrong, use brain.'" And it was a tremendous sign. And I thought, actually, we know that. We laugh at that. Our clients don't really know, I think, by and large, that their pets have a brain that can hurt, that can cause dysfunction and distress, often for the whole of their pets' lives. And how much better could we make the dog and cat world if we could go a little way towards alleviating that pain? And I called you earlier probably the best veterinary neurologist in the world. I think you are, because you are going that way to making their lives better. And thank you.
Oh, thank
for
you
the
very
whole
much
of
indeed,
for
both of
doing
you.
that.
You're
Thank
very welcome.
Thank you.
And we haven't covered your amazing YouTube channel.
No, we haven't. Was it about one new video a week? Is it?
I started it on a whim last August, and I thought I'll keep doing it till I have 52 in a year, and I'm now 42. I must admit I haven't put anything up there for a couple of weeks, but yes, the aim was really to have a means of neurological knowledge that was free. There is a lot of resources that are free, but it was really an aim to make it more available, especially for people who are in countries where there aren't any veterinary neurologists yet. And also a resource for neuropathic pain and Chiari malformation. So somewhere to put all of that information. So check it out. It is Neurovet Clare, and reasonably easy to find now. And they range from quite simple videos, which I'm trying to fill out the simple topics like what causes circling. Planning to do facial nerve paralysis is my next one, to the really quite complicated ones like is it a headache and neuropathic pain. So it's quite a spectrum there, but it's fun. I've learned things that I didn't know that anything about this time last year. How to use I got a green screen for Christmas. Been learning how to manipulate videos in green screen. I just learned that I don't have to sit at one corner of the green screen. I can move my image. This was something I learned very recently. I had a lot of eye rolling from my son when I realized that, and other sort of video editing stuff. I have an enormous microphone as you can see.
That's a pretty big microphone, Claire. But for those listeners, Claire has just shown us a microphone about the size of the Eiffel Tower.
Yes, it's a little bit phallic as well, I think, as well.
best not to go into that.
Let's not compare the size of our microphones. So if anybody wants to learn from one of the true masters, get yourselves onto YouTube. It's actually at Clare-Neurovet or Neurovet. And I've been having a look at it today, and there's a wealth of information there. Some very simple, some very highbrow, and just get on there and have a look. If you've got any questions about neuropathic pain or neuropathy, then get onto YouTube at Neurovet or at Clare-Neurovet and have a look for yourselves. Claire, it's been an absolute privilege to speak with you tonight.
Fun.
We've learnt so much, and hopefully our listeners and our viewers will give us the feedback. Just contact us through veterinaryramblings.com, drop us an email, drop us a line. If you've got any other questions, please like and share, and please subscribe, because it really makes a difference. And so from everybody here at Veterinary Ramblings, Clare Rusbridge, thank you so much for sharing. May your dog go with you.
May your dog go with you.
All right. Well, thank you too very much. Thank you for having me on. I had a blast.
Well, thank you.
Yes.
Thank you so much.
All right.
See you soon.
Bye-bye. Bye.
Good night, Claire.
Bye.
Bye-bye.